are we doing?
Good, how you doing?
Good. Can you give me your name and your date of birth?
Kyle Thomas Colburn, January 30, 98.
Okay, perfect. So I'm just going to start out. I'm going to get your blood pressure and your heart rate to begin with.
Okay.
You just rest your arm for me. Okay. 130/80, so that's pretty good. It's pretty normal. And then I just want to assess your pulse. I'm going to do this side just because I just took your blood pressure on that side. Okay, it's about 75. That's pretty normal. Okay. And then I just want to do your pulses on both sides. Your arms. They're the same. And then uncross your feet for me. I'm going to pull your shoes off. Okay, you can rest them. And they're the same. And I don't see any signs of any edema, which is just like any abnormally puffy areas. And your feet. All right. And your capillary refill. Okay, can I see your feet? Put them up here. Okay, and your other one. Perfect. So have you had any chest pain recently? It feels like someone's kind of sitting on your chest. It could feel like it's radiating anywhere, anything like that?
No.
All right. Any shortness of breath?
Nope.
Okay, fantastic. Have you felt, other than kind of like exercising and stuff like that, do you ever feel like at rest your chest kind of starts fluttering or anything like that?
Not usually.
Okay, other than when you see your wife, I'm sure. I don't see any signs of any cyanosis, which is any bluish tints. Anything. All right. Have you felt dizzy at all when you go from like lying to sitting or sitting to standing?
Just if I stand too fast sometimes.
Okay, all right. If it continues to progress, I would let us know. Sometimes it's orthostatic hypotension, so if you get up too fast from a different position, your blood pressure can go way down and then it can make you feel dizzy. And last thing we want you to do is like get off balance and fall. You haven't noticed any abnormally red portions of any skin or anything like that?
Nope.
Okay. Do you have any cardiac related, like heart related problems with your past medical history at all?
No.
Okay, anyone in your family?
Nope.
Okay. Do you smoke cigarettes?
On and off.
How often do you smoke?
It was every day, and then now it's not nearly as often.
Okay. Would you like some pamphlets on how to quit smoking?
No, thank you. I think I'm fine.
Okay. How would you rate your activity from sedentary, meaning you barely exercise, to very active, going to the gym, 4 or 5 times a week?
I'd say mildly active.
Okay. And then What does your diet usually consist of? Like on a daily basis? I know it's kind of hard because you eat different things.
Lots of red meat, potatoes, chicken every now and then, and some like mixed vegetables.
What about alcohol? How often do you drink per week?
About 2 to 3 beers a week.
Okay, so just socially. And have you been abnormally stressed at work?
Mm-mm. Just like normal meal as everybody else.
Sometimes consistent stress can put an increased workload on your heart, so that's why I asked.
It's more so inconsistent.
Okay, all right. And how's your sleep schedule been? How many hours do you usually get?
I usually sleep about 5 to 7 hours a night.
Okay. All right. You feel like that's adequate for you? Are you feeling fatigued throughout the day at all?
It's adequate most days.
Okay. So then that's my cardiovascular assessment. And then the last thing is the 3. So I kind of want the carotid pulses and the jugular vein distension to kind of couple as one. So for that, I look to see if there's any veins popping out of his neck. They're usually like pretty thick. He does not. And then assessing carotid arteries, you use your 2 fingers and push like right up behind the back of their jaw. You don't want to do it at the same time though, because you can make the patient pass out. And you're just looking to make sure that you can feel a pulse and that they feel pretty regular. And then patients that have fistulas, AV fistulas, that's the second thing I would like to assess. He does not have one, but if I were, I would assess for a thrill and a bruit. The thrill is when you're actually feeling it, and it'll kind of feel like a pulsating motion. And then the bruit, that's when you're auscultating it and you're listening for it. And then the third thing that I want to assess is the Hohmann sign, which you usually assess if you don't think somebody has a DVT, which in his case he does not, that I know of. But typically you don't want to do it in the hospital if you think somebody does, because you don't want to risk breaking that clot off. Okay, so just take each foot one at a time and put them out and just bend your foot towards you. Any pain?
Nope.
Okay. And the other one? Any pain?
Nope.
Okay. And I almost forgot to actually listen to his heart, so we'll do that. And then there's the 4 to 5 spots that you listen to. All physicians take money. And then that is all the portions of the heart. So all physicians take money. Yeah, 4. Any questions for me?
Nope.
All right, fantastic. Well, I'll let the doctor know that you're ready.